First of all, I have no conflict of interest. Although I use figure generated by ChatGPT, I don't have any financial ties with ChatGPT or its affiliates. Our team employs 4S framework in applying AI to manage infectious disease within frontline healthcare settings such as ERs. This includes surveillance, syndromics, screening, stratification, and I'm going to share with you our experience in these areas. In healthcare, accurately assess pretest probability is crucial for effectively screening for potential illnesses and stratifying patients based on their risk levels. Traditionally, we depended on databases that collect data through sentinel reporting or direct report from the healthcare agency. Within AI advancement, we can now utilize a broader array of data resources, including social media, electronic medical records, and news reports for early detection. A prime example of innovative surveillance comes from the Taiwan CDC, which aggregates diagnostic codes from emergency department nationwide into a real-time disease outbreak surveillance system right before the pandemic, illustrating the potential of comprehensive data utilization. The surveillance system employs various analytical methods, including traditional autoregression methods, as well as advanced technique like random forest, support vector regression, extreme gradient boosting models, and the ensemble models. Our team also have the similar approach. Before delving into our methods, let's introduce the Chang'e Memorial Hospital system, which initiated a forecast system to predict emergency department volume and human resource allocation just before the pandemic outbreak. The Chang'e Memorial Hospital accounts for 1/10 of the national health expenditure with its 8 branches and unified electronic medical records developed in-house, handles a large volume of hospital visits. The histograms show that ED in the Linkou branches alone sees up to 16,000 visits per year. Our electronic medical records has been pivotal, not just in managing extensive patient visits, but also as a foundational tool for in-depth research. It boasts a more comprehensive data collection compared to the national databases like the National Health Insurance Research Database, thereby providing researchers with a wealth of detailed information for analysis. Moving back to our methodological approach, we first apply conventional time series analysis techniques, including autoregression and trigonometric predictor, as well as Poisson regression, to forecast healthcare demands. We then explore and compare these traditional methods with newer time series approaches like long short-term memory network and the profit method developed by Facebook Meta research team. The right-hand quadrant shows these methods' effectiveness in closely following actual visits numbers. The profit method, a novel approach proposed by Facebook, utilizing the conventional generalized entity model. It maximizes forecast accuracy through Monte Carlo methods, effectively capturing seasonal trends. And early in the pandemic, our team applied the general entity model to analyze antibodies' responses against COVID-19, integrated data on spike protein and receptor binding domain protein interaction to avoid time-consuming and risky traditional viral visualization tests. We extended this model to analyze data from wearable devices monitoring vital signs in patients who lack continuous monitoring. Here you can see a case study of an 80-year-old female patient tracking changes in cardiac output and vascular resistance. Our surveillance effort included predicting the SARS-CoV-2 lineage BA2.3.7, which was prevalent in Taiwan's 2022 outbreak. We utilized the image transformation and machine learning algorithm for early identification. We applied dimensionality reduction techniques like the t-SNE and kernel PCA after encoding sequencing data with the camera methods. This transformed the data into the image for deep learning analysis. Our evaluation of various deep learning methods in identifying the target lineage showed satisfactory accuracy in both training and testing datasets. The boosted tree methods outperform the others, including support vector machine and deep learning approaches. Our team employs 4S framework in applying AI to manage infectious disease within frontline healthcare settings such as ERs. This includes surveillance, syndromics, screening, stratification, and I'm going to share with you our experience in these areas. Okay, let's go back to the second part of syndromic surveillance. In collaboration with Johns Hopkins University, sponsored by the NIAID, we've undertaken extensive influenza surveillance, employing machine learning to improve prediction and understanding influenza infections. This work is a testament of the power of the international collaboration in advancing public health research. In our detailed manuscript, we've utilized the duration of illness as a proxy to evaluate the predictive power of individual symptoms for influenza infection. We present a dynamic core diagram illustrating the early detection capabilities of our symptom tracking system, which encompasses general illness indicators such as malaise, body ache, shortness of breath, and chest pain during the progression of influenza-like illnesses. We then use the machine learning to integrate symptom data for prediction influenza infections. This model has shown promising performance, surpassing traditional methods in certain respects, and is also being adapted to assist frontline healthcare workers in identifying potential influenza cases. Early in the outbreak, we conducted a systematic review and meta-analysis to assess how symptoms can help in early detection of COVID-19. Our findings highlighted differences in symptom presentation between children and adults, notably in fatigue and malaise. Our study also identified several factors that influence the accuracy of symptom-based prediction for COVID-19 infection and its severity. This includes study design, age distribution, viral lineages, among the others. We then explored the capabilities of large language model, the advanced NLP techniques to extract meaningful information from EMRs to improve phenotype identification and symptom analysis in infectious disease research. In 2023 saw rapid development in large language models with significant implication for the medical field. We've explored models like Gittertron, Neutron, and Metatron, which offer enhanced capability over earlier models like BioBirds and ClinicalBirds. By applying state-of-the-art NLP methods, we've begun to extract meaningful phenotypic information from EMRs, previously unattainable with conventional data processing techniques. Interestingly, our EMR data includes records in English by physician and in Chinese by the nursing staff. We've employed specific NLP methods to effectively analyze the bilingual data uncovering valuable insights. Early results from applying large language model to identify symptoms in patients with influenza-like illnesses indicate promising direction, though challenges remain in optimizing precision and recall. Our team also have experimented with deploying large language model within the intranet-only environments, aiming to provide enhanced question answering capability and support for clinical decision making. Our team employs 4S framework in applying AI to manage infectious disease within frontline healthcare settings such as ERs. This includes surveillance, syndromics, screening, stratification, and I'm going to share with you our experience in these areas. And the next one is the screening part. Utilize AI to analyze biomarker and data from wearable devices. We've developed predictive models for identifying infection and forecasting severe complications such as septic shock, demonstrating AI's potential in preemptive healthcare strategies. Our model also aims to distinguish between patients with influenza and those with COVID-19, enhancing our ability to respond to patient needs more accurately. By employing spectrometry alongside principal component analyses, we've innovated in detecting pathogens based on base pair composition, bypassing the need for traditional sequencing. This approach signified a leap forward in rapid cost-effective pathogen identification. Our team employs 4S framework in applying AI to manage infectious disease within frontline healthcare settings such as ERs. This includes surveillance, syndromics, screening, stratification, and I'm going to share with you our experience in these areas. And then the last part is about the risk stratification. In the final segment of my presentation, I will concentrate on pivotal topics of risk stratification, enhancing our readiness for disaster and probing into the efficacy of treatment responses. Allow me to reacquaint you with the SEERS network. This collaborative framework was established across two key capital regions in Taiwan and the US. Within this network, we've implemented consistent criteria for the enrollment of patients exhibiting symptoms of influenza-like illnesses. Our methodology for collecting patient data and biological specimens are standardized, ensuring uniformity and precision in our research protocol. In leveraging the extensive data collection through our network, our objective is to decipher the various clinical presentations that arise in patients infected by the same pathogen like the influenza virus. We employ advanced deep learning techniques, specifically unsupervised learning methods such as autoencoders. These methods are designed to uncover patterns and association within the data that may not be immediately apparent to human researchers. Essentially, deep learning networks distill the input data through the multiple hidden layers, condensing the information before reconstructing it at the outer layer to mirror the input as closely as possible. If the network can accurately recreate the input data, it indicates that the latent layer have successfully captured the essence of the data. These data layers may hold the key to new insights that have previously eluded human understanding. Our initial findings shows that machine learning can effectively cluster observations of influenza-infected patients, offering new insight into the disease impacts. We are assessing, we're also assessing the possible utilization of this cluster to identify severe populations. Our work extends to using symptoms and biomarkers to predict mortality among patients with suspected sepsis in the ER, aiming to improve early intervention strategies. By combining clinical information, biomarkers, and scoring systems, we've developed an algorithm based on random forest methods that outperform existing scoring systems in predicting infection outcomes. We've also adopted remote photoplethysmography as a contact-free method for patient evaluation during the pandemic, aiding in patient monitoring while minimizing infection risks. We also investigated efficacy of traditional medicine practices by analyzing radial pulse wave measurements, aiming to understanding how these practices may complement conventional medical treatments. Back to the Sears network, one of our research includes studying the impact of co-infection among patients with influenza B. This study, which was accepted for publication without revision, found that co-infection significantly increases the odds of developing severe complication after adjusting for potential confounder. We then investigated how specific virus characteristics correlates the patient phenotypes in H1N1 influenza A virus infection. Using machine learning algorithm to analyze the association between different virus clades and disease severity. Using the recursive partitioning algorithm, we developed models to predict the propensity of being infected by different clades of influenza A viruses. After weighting the propensity to adjust potential confounders, our approach has shown significant association between 6B2 and development of pneumonia. Building our knowledge from studies of influenza B and H1N1, I'd like to highlight our recent work on H3N2 strain of influenza A. Our research efforts have been focused on evaluating the impact during a separate influenza season, aiding to the body of knowledge on influenza virus behavior and epidemiology. Our manuscript, which has been recently accepted by the Lancet Microbe, present the collaborative work within the former postdoc fellow Xuan Liu, along with the team from Andrew Pecko's lab and our team in Taiwan. We've assessed the correlation between viral reassortment and disease severity by conducting comprehensive whole genome and phylogenetic analysis, supplemented by the machine learning techniques. Notably, the 2017-18 flu season in the US was marked by the successive predominance of the H3N2 virus, which resulted in unprecedented levels of infection and severity. A particularly intriguing discovery in our research is the identification of reassorted virus within the 2017 and 18 H3N2 influenza A strains. Genetic segments from the 3C2A1 clades were found intermixed with other clades, as illustrated in this cartoon figure, heat maps, and detailed phylogenetic trees. The resorted H3N2 virus not only replicated more effectively in the lab settings, but also show a significant association with severe outcomes just before and after the application of machine learning methods to adjust for confounders in our study, allowing us to more accurately assess their impact and on disease severity. Furthermore, using the Taiwan National Health Insurance Research Database, we've also observed trends in sepsis incidence and mortality, noting an increase in incidence but a decrease in mortality, possibly due to the improved guidelines adherence. Our analysis of this database also uncovered a notable association between stroke and cancer. This finding encouraged further research to explore the underlying mechanism and potential clinical implications. These insights demonstrate the immense value of large healthcare database in uncovering relationships that can guide both clinical practice and biomedical research. Recently, we're collaborating with researchers in China exploring the use of advanced deep reinforcement learning methods to predict treatment responsiveness. This work is in progress and aims to leverage our database for enhancing patient care. In conclusion, our journey through the application of AI in infectious disease management from surveillance and prediction to treatment responsiveness highlights the transformative potential of this technology in healthcare. I extend my deepest thanks to our collaborator at Johns Hopkins University, our dedicated team in Taiwan, and all of you for your attention. I look forward to engaging discussion and any question that you might have. In conclusion, our journey through the application of AI in infectious disease management from surveillance and prediction to treatment responsiveness highlights the transformative potential of this technology in healthcare. Our team employs 4S framework in applying AI to manage infectious disease within frontline healthcare settings such as ERs. This includes surveillance, syndromics, screening, stratification, and I'm going to share with you our experience in these areas.